What is a seizure? A seizure is a surge of abnormal electrical activity in your brain. The most recognizable symptoms of a seizure are a temporary loss of consciousness and uncontrollable movements or convulsions. Not all seizures look the same. You might stop what you're doing and stare off into space for a few seconds. You might jerk your arm or feel your muscles twitch. You might only have one seizure in your life or have multiple seizures per day. Your experience with seizures can be very different from someone else's. There are many possible causes of seizures because a lot of things can interfere with your brain's typical electrical patterns. These range from changes to your blood sugar levels to an illness, injury, or underlying condition. What are the types of seizures? There are two main types of seizures. Generalized seizures. Electrical activity starts on both sides of your brain at the same time. You may shake both sides of your body, shake one side or only stare and stop what you're doing. Usually it affects kids or young adults, but it can occur at any age. Focal seizures. Electrical activity begins on one side, or focus of your brain. Symptoms usually affect one side of your body and may or may not affect your awareness. This means that you may or may not remember the seizure. Focal seizures may stay focal or may spread to both sides. The types of generalized seizure disorders include absence seizures or petite mole seizure. You stop what you're doing and have a blank stare. Atonic seizures. You lose muscle control and drop to the ground suddenly. Clonic seizures. You'll shake both sides of your body and pass out or shake one side and not pass out. It is characterized by rhythmic, jerking muscle movements, typically affecting the arms and legs. Myoclonic seizures. These involve a quick jerk or twitch that affects one muscle or a group of connected muscles. Secondary generalized seizures. You have a focal seizure followed by a generalized seizure. Tonic-clonic seizures. Your muscles stiffen, you lose consciousness, and have convulsions. Tonic seizures. You pass out and your muscles tighten up, but you don't have convulsions. The types of focal seizure disorders include focal onset aware seizures, or simple partial seizure. You're aware of a seizure when it happens and able to remember it. Focal onset, impaired awareness seizures, or complex partial seizure. You lose awareness and experience confusion when the seizure happens and can't remember the seizure. What are the symptoms of a seizure? Loss of consciousness. Uncontrollable movements like convulsions, muscle spasms, jerking, staring. Sudden emotional changes like confusion, fear, joy, anxiety, teeth clenching, drooling. Abnormal eye movements. Loss of bladder or bowel control, noise-making, grunting, or snorting. These symptoms are temporary and only last for a few seconds, 2 minutes. What are the stages of a seizure? 1. Prodrome phase. Before a seizure. You may notice mood or behavioral changes, feel lightheaded, or have trouble focusing. Days before a seizure, you may have trouble sleeping. 2. Aura phase. Right before the first symptoms of a seizure start. You may notice vision changes, a headache, dizziness, nausea, anxiety, or fear, and changes to your senses like taste, sound, smell, and feeling. 3. Ictal phase. This is when a seizure happens. You'll experience seizure symptoms. 4. Postictal phase. Immediately after a seizure ends. You may feel confused, exhausted, sore, strong emotions, and more. What are the warning signs of a seizure? Sensory symptoms. Seeing bright lights or distortions in how objects appear, hearing unexpected sounds, sudden unexpected tastes or smells and strange feelings on your skin. Emotional changes. Strong emotions like fear or joy. Déjà vu or jamais vu. Autonomic symptoms. These affect body systems that your brain runs automatically, like sweating, making too much saliva, an upset stomach, and pale skin. What causes a seizure? A surge of electrical activity in your brain causes a seizure. Neurons communicate by sending electrical signals to different parts of your brain. When a seizure happens, the affected brain cells fire signals uncontrollably to others around them. This kind of electrical activity overloads the affected areas of your brain and causes seizure symptoms. Seizure causes fall into two main categories depending on why they happen. 1. It's provoked seizures or non-epileptic. A trigger, which could be a temporary condition or certain circumstances, causes seizure symptoms to happen. 2. Unprovoked seizures or epileptic. Seizures happen spontaneously. They may happen often. These seizures are the primary symptom of epilepsy. Seizure triggers. 1. Abnormal blood sugar levels. 2. Certain medications, such as Wellbutrin or bupropion. 3. Flashing or flickering lights. 4. Heat illness. 5. High fever. 6. Sleep deprivation. 7. Stress. 8. Substance use. Triggers are different for each person. If you have seizures regularly, you may want to keep track of what you were doing before a seizure took place. A healthcare provider can review this information with you to determine your triggers. Conditions that cause seizures. 1. Aneurysms. 2. Brain tumors. 3. Cerebral hypoxia. 4. Cerebrovascular disease. 5. Diabetes. 6. Severe concussion and traumatic brain injury, especially ones with loss of consciousness. 7. Degenerative brain diseases like Alzheimer's disease or frontotemporal dementia. 8. Eclampsia. 9. Electrolyte problems, especially low sodium, calcium, or magnesium. 10. Epilepsy. Seizures that happen frequently without any clear underlying cause. 11. Genetic conditions. 12. Hormone-related changes. 13. Infections, especially encephalitis, meningitis, or sepsis. 14. Inflammation from autoimmune conditions. 15. Mental health issues like conversion disorder. 16. Problems with how your brain developed. 17. Strokes. Diagnosis. A healthcare provider, usually a neurologist, will diagnose a seizure after a physical exam, neurological exam, and testing. During the exams, your provider will learn more about your symptoms and review your medical history and family health history. It often helps to have someone with you during your appointment who witnessed the seizure to explain what they noticed. As you might not remember what happened, tests to diagnose seizures include 1. Blood tests. 2. Computed tomography or CT scan. 3. Electroencephalogram or EEG. 4. Genetic tests. 5. Magnetic resonance imaging or MRI. 6. Positron emission tomography or PET scan. 7. Spinal tap or lumbar puncture. Management and treatment. 1. Managing any underlying causes or conditions. Your provider will first treat any underlying conditions, like a stroke or low blood sugar. This may prevent future seizures. 2. Taking anti-seizure medications. Medications may help prevent seizures or decrease how often they happen. 3. Surgery. Surgery may reduce seizure frequency and severity by addressing the area of your brain where seizures start. For brain stimulation, a surgeon will implant a device into your brain to deliver a mild electrical current. The current interferes with and tries to stop abnormal electrical activity. There are different types of brain stimulation available, like vagus nerve stimulation. Seizure medications can help you manage seizures by 1. Stopping a seizure as it happens. 2. Preventing future seizures. 3. Reducing the severity of seizures. 4. Reducing the frequency of seizures. Common medications for seizures include, but aren't limited to, the following. 1. Benzodiazepine. 2. Carbamazepine. 3. Diazepam. 4. Gabapentin. 5. Lamotrigine. 6. Oxcarbazepine. 7. Phenytoin. 9. Valproic acid. Prevention. Seizures are unpredictable, so it's not possible to completely prevent them. The best thing you can do is avoid possible causes or triggers, like managing blood glucose levels or protecting yourself from illness and injury. By Joshi Joseph.